of Relationship Matters. I'd like to begin by acknowledging our traditional owners of the lands upon which we're meeting. I'm here in the Wurundjeri land, the Kulin Nations, and I'm sure that others are also in other lands around Victoria and around Australia. So welcome everybody. I'd like to pay my respects to their elders past and present and emerging. The format of today will be a presentation to provide a background about Religious Discrimination Bill, followed by a panel discussion that deals with the real world implications of the bill. Everyone except the panellists will have their video turned off and their audio muted. You can see the chat feature, or you can use the chat feature, and I know many of you already are, in order to be able to communicate with each other, but also with the panellists. So if you're not new to Zoom, if that's possible, after 3 months of COVID, in the bottom, along the bottom, you'll see a toolbar, and one of those options is the chat option, which you can put up on the side. It's probably a good idea to also have, for better sort of viewing, to have your Zoom set up as a speaker view, and that way the person who's speaking will pop up and you'll be able to see them more clearly. Have I covered everything? Yes, so select active speaker. I should let you know that this event is being recorded, so I think probably without any further ado, even though there's still a few people arriving, to kick us off, I'd like to invite Ghassan to get his presentation ready while I introduce you. So Ghassan is the Legal Director of Equality Australia. He has been involved in LGBTIQ advocacy for over a decade, including serving as the Policy and Development Coordinator of the New South Wales Gay and Lesbian Rights Lobby from 2007 to 2009. I think I might have held that post or something similar myself about a decade earlier. Ghassan has taught public law and has experience as a senior commercial litigator in Australia and overseas. Over to you, Ghassan, to run us through the bill.
Thanks very much, Janet, and good afternoon, everyone. I also would like to acknowledge the land on which I come to you from. I'm actually up in New South Wales at the moment on Gadigal land of the Eora Nation, and I pay my respects to elders past, present and emerging. Before I get started with my breakdown on the Religious Discrimination Bill, I wanted to start by giving you a flavour of some of the issues that the bill presents by playing this very short video. So if you bear with me, I'm just going to share my screen with you.
A bill has been drafted that threatens to divide our communities. The Religious Discrimination Bill will give people a licence to discriminate.
The bill would mean we're less protected under the law. It will leave us all vulnerable.
What constitutes discrimination today will be considered okay tomorrow. It will take away your rights at work, at school and in hospitals when people say offensive things. Things like,
my waiter telling me that my relationship is an abomination in God's eyes.
My support worker telling me that disability is caused by the devil.
It's not okay for a manager to tell us that we are oppressed by our faith because we are women.
This bill could see some of the most vulnerable in our communities encounter judgment and closed doors when they most need our compassion and support.
It's not okay for my nurse to tell me that HIV is a punishment from God.
It's not okay for a teacher to tell either of my daughters that my ex-wife and I are still married in God's eyes.
This bill will divide our communities.
It will take us backwards.
It will affect us all.
Our laws should protect all of us equally.
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 And this bill threatens that. We need your voice.
Okay, now I hope the sound came through well for you. I'm just going to put up my presentation and I'll take you through the detail of the bill and provide you some, hopefully some examples to take you through what might seem a fairly complicated piece of legislation, and that's one thing I hear more than anything, is that this is a really complicated and difficult to understand legislation. So what I'd like to do is really unpack it for you today, give you a flavour of the key things that concern us at Equality Australia about the aspects of this law, and then take you through where the proposed legislation's at and what you can do to share your voice in the debate. So let's start with the basics. The Religious Discrimination Bill at the moment is in a draft form, so it has been put out for consultation to communities. We've had 2 rounds of consultation. It was due to be introduced into Parliament in March before COVID hit, but has been delayed because of that. At its core, what the Religious Discrimination Bill tries to do is provide protection against discrimination, either on the basis of having a religious belief or engaging in religious activity, or not having a religious belief or refusing or not engaging in a religious activity. And it does that in a range of areas. So employment, goods and services, provision of services, education are some of those areas. So effectively what it tries to do is say you can't discriminate against someone on the basis of having a religious belief or engaging in religious activity or not in those areas of public life. But where the bill then departs from that tried and true formula for most discrimination laws is why it is presenting such a threat to many rights that we enjoy currently under discrimination law. And there are 3 key areas where this bill causes us concerns. The first is the way that it removes existing discrimination protections for everyone else to privilege certain statements that are made either about religion or based on religious beliefs. So statements like you saw in the video, like homosexuality is sinful, or women must submit to their husbands, disability can be cured by prayer, or a child is harmed by having an unmarried parent. Now, where those statements are currently made, say by a boss or a colleague or a teacher or a health professional or service provider, those statements today can constitute forms of discrimination. So if a worker, or if an employer says that to their employee, or if a colleague says it to another colleague, today you might be able to complain about those kinds of statements being made in your workplace or at your school or in the provision of goods and services as constituting discrimination on the basis of things like disability, gender, sexuality, etc. What this bill says is those kinds of statements will not constitute discrimination under any of the existing discrimination laws that exist at a state and federal level. So across every ground, race, disability, sexuality, gender identity. It also restricts the ability for large private sector employers with revenues of over 50 million, and also professional bodies that license professions like doctors, nurses, psychologists, even lawyers, accountants. It restricts their ability to respond when a member of their profession or one of their colleagues makes these kinds of statements outside of the workplace, but nonetheless impact on the way that colleagues, clients, members, patients, others might see those statements. So this is sometimes been referred to as the Falau clause, which is really dealing with that situation where someone makes a statement, say, on their Twitter account that is discriminatory, and an employer or a professional body seeks to take action in respect of that statement by, for example, disciplining that employee or the member of that profession. So what this bill says is it's much harder for those kinds of institutions to take action when people make discriminatory statements based in religion or about religion. So it also impacts on people of faith, because it allows people to make statements about other religions, or if you have no religious belief, about religion as a whole. The second area of key concern is in relation to healthcare. And what this, there's provisions of what they call conscientious objection provisions. What it does is it makes it harder for the employer or a professional body that employs or regulates doctors, nurses, midwives, pharmacists, and psychologists to impose rules that require those health workers to provide services to everybody, healthcare to everybody equally. So what employers of health workers, those health workers, and professional bodies will not be able to do is prevent a doctor or a nurse refusing to provide treatment to someone based on a religious belief, except in very limited circumstances. The issue with those circumstances is that a patient's health can be impacted negatively before a clinic or a hospital could say, for example, to a nurse that's rostered on a shift, you must provide the service that this patient needs. Or so we're talking here like contraception as an example. Someone walks into a pharmacy, the pharmacist refuses to dispense the pill or PrEP or PEP, or provide assistance or a referral in IVF or fertility, those sorts of services where religious views may impact on a person's view as to whether that treatment conflicts or not with their religious belief. The real concern is these provisions put those religious beliefs above the patient's healthcare. So what it does is it shifts the priority from the patient and ensuring the continuity of care for that patient to prioritising the objection of the doctor or the nurse to providing that care where it conflicts with a religious belief. The third area, which we've broadly dubbed the double standards in the law, are our concerns that this law impacts on institutions and on people differently, depending on whether or not they have a religious belief. So, for example, faith-based organisations will be allowed to continue to discriminate against others with different beliefs or no belief, even when providing publicly funded services in some areas. They'll be able to do that also in employment, so when they employ people. At the same time, things like the protections on statements based on religious beliefs or no belief allow people of faith to express views and get protection around a range of issues informed by their belief, while those with no belief will only be protected when they express views only about religion. So these are some of the double standards that come about from this law. The other concern is, for example, the way that it protects people associated with people of faith. So, for example, if you have a director or a manager that has a particular religious view, the entity that's associated with that manager is also protected from religious discrimination if there's a action taken against it because of its association. And we don't see some of those protections afforded currently, for example, between same-sex couples and their children. So there's a real imbalance around the way that federal laws generally now protect LGBTI people, for example, when it comes to faith-based organisations, when it comes to private schools, when it comes to their children. And this bill also instills a freedom of religion commissioner at the Australian Human Rights Commission, where currently LGBTI people don't have one of their own. So there's a range of issues where this piece of legislation instills double standards in the law, depending on whether or not someone has a religious belief. if we're looking where the bill is currently at, as I mentioned, it's a draft piece of legislation. So it's been released for exposure. An exposure draft has been released for consultation. There's been 2 rounds of that. There's been widespread criticism from the bill from both sides. So both those that want the bill to go further in providing people of faith with certain protections, and those that oppose the way that the bill has been drafted in tipping the balance too far in favour of certain forms of religious views over the discrimination protections that others currently enjoy. So that is why we have been opposed to this piece of legislation, because we believe that our laws should protect all of us equally, and we feel that this law hasn't achieved that balance. Currently, because of COVID, the bill was due to be introduced into Parliament in March, but was delayed, especially because some of its provisions that deal with healthcare have required further consultation from the health sector, and the health sector have been among the most critical of this law, particularly around those conscientious objection provisions. So we expect once the situation with COVID to settle down, that the government will press ahead with introducing this bill into Parliament, subject to a further inquiry. When that will be, we are not sure, but there's been a concerted push, particularly from the Australian Christian Lobby, to push it back on the agenda. And so our best guess is that the bill will return probably next year, but could be as soon as the end of this year, back to where it left off, which is ready for presentation to Parliament for further inquiry. In terms of where the other parties are sitting, Labor and the crossbench, like Centre Alliance and Jackie Lambie, Senator Lambie, haven't said whether they will support or oppose the bill, whether in whole or in part, but have sort of kept a watching brief. And we don't know where, for example, the One Nation senators currently sit as well in respect to the legislation. But as I mentioned, we've seen broad range of community opposition to aspects of this bill. Unions, business groups, faith-based organisations have come out actually opposed to this bill, and particularly the aspects that impact on healthcare, that impact on discrimination protections for others, and import those, unbalanced provisions that have the double standards in them. In terms of ways that people can take action, the simplest and easiest way, if you haven't already, is to email your MP. And we've put a form on our website, equalityaustralia.org.au, which allows you to put in your details, and it works out your MP, and you can tailor your response and write to your MP opposing the bill. You can also sign on to our Freedom from Discrimination statement. And if you have an employer that you think would be likely to also sign on or support the cause, or you're part of an organisation, they can also sign on and pledge their support for that statement as well. During June, we're lucky to have a donor that's agreed to match donations to us as well. So to help us support the work that we're doing, particularly in opposing this bill, it's a great opportunity now to send some money our way, which pays for things like our work in Canberra, our analysis, and getting the word out on this law. And we also have a series of fact sheets which you can access from our from our website, which deal with particular segments and how they impact. So we've got a fact sheet on workplace, on healthcare and in education, as well as a particular fact sheet dealing for people with disabilities and mental health issues, and also for women and people of faith. And it looks at how the law impacts in those particular segments of our population in particular. So that is the presentation. I hope that gives you a good flavour of what the legislation requires. I see some questions have come through, but I might just hand back to you, Janet. I haven't had a chance to
Definitely. No, that's
follow
right.
them.
Definitely. What we'll do is we may just introduce the rest of the panel, Ghassan, and then come back and the panel can have a crack at each of the questions. So just to remind everybody, use the chat function to post your questions, and we'll get to as many of them as we can in the time that we've got available. Thank you very much, Ghassan. That was really interesting. It was a great overview. I think one of the big key messages for me is that this isn't going to go away. It's not looking like it's going away despite COVID, and that we need to keep the pressure up and be ready for another fight either later this year or early next year in Parliament when the bill then goes up for Parliament. And presumably the second inquiry you're talking about is a Senate inquiry, is it, or a parliamentary investigation of the bill?
It'll be parliamentary, but we don't know whether it will be Senate or not.
But most likely there'll be further examination of the bill as it goes up. All right. Well, thank you very much for that presentation. It was great. I'm sure everybody's will join me in agreeing that that was fantastic. It's very hard to do this when your camera's off or whatever it is. So I might just ask the panel now to turn their cameras back on and unmute themselves, and I'll start introducing you as we go along. Bronwyn Pike, I'm going to introduce first. Hi, Bronwyn. You can say hello.
Hi,
so you pop up on everybody's screen. Bronwyn's the CEO of Uniting Victoria Tasmania, which is an organisation that was formed in 2017 with an amalgamation of a lot of the other uniting organisations around the state. I believe you're the largest now community service organisation in Tasmania, with a 100-year tradition of uniting church agencies working alongside local communities. The organisation delivers a broad range of services in areas of aged care and carers, alcohol and other drugs, children, youth, families, crisis and homelessness, disability, early learning, employment and mental health. So you've got most of the human services covered off there. And of course, we all know Bronwyn from her years as Minister in the Labor government, Victorian State Labor government. So thank you very much for joining us today, Bronwyn. I'm going to throw you a question in a second, but meanwhile I might introduce everybody else if that's okay. Heath Paynter is the Deputy CEO of the Australian Federation of AIDS Organisations, AFAO, that leads Australia's community response to HIV and contributes to action on HIV/AIDS globally and in Australia and the Pacific. So Heath,
hello.
So you pop up. Say something more.
Hello, thanks for having me.
No, I'm not sure you would have popped up, but anyway, we'll see how we go. In Australia, AFAO leads the national effort to end HIV on behalf of its member organisations that represent diverse communities most affected by HIV, LGBTIQ communities, sex workers, people who inject drugs, people with HIV, and Aboriginal and Torres Strait Islander communities. Heath's professional background includes more than 15 years' experience working as a lawyer and providing public policy advice on human rights, cancer control, sexual health, HIV/AIDS and other bloodborne viruses. Welcome, Heath.
Thank you.
And last but absolutely not least, we've got Jamie Gardiner, who the bio here says, if you don't know Jamie, then I'm not sure where you've been, but Jamie's a long-standing human rights, gay and gay rights activist. I think I could say LGBTIQ rights activist, actually, Jamie. He's the Vice President of Liberty Victoria, a member of the Victorian Government's LGBTIQ Task Force, and has served as a member of the Victorian Equal Opportunity and Human Rights Commission from 2000 to 2009. And we have to thank, it's on Jamie's shoulders in many areas of the rights that we enjoy here in Victoria for all of your hard work. So Jamie, say hello so I can see you.
Hello, Janet. Hello, everyone. Thank you for those kind words, and thank Ghassan for the description of the awful subject of today's meeting.
Yes, well, we need to put this this crazy idea to bed, I think, and the fight will be on. So let's get into some of the questions so we're all on the same page, and we all are sharing the same understanding about the bill, and then maybe we might wrap up with a little bit more of a discussion about what we can do to get rid of this bill. So Bronwyn, my first question's for you. Various bishops and religious leaders around the country, and we have to acknowledge that Uniting Church has been a little bit better than some of the other churches, but various bishops around the country have argued that religious charities, schools and services should be allowed to discriminate in employment and service provision based on religious belief. You're the head of a large faith-based social service organisation that covers 2 states. Can you see a need for these types of services to have exemptions under our anti-discrimination laws? Where does it fit in your business?
Well, certainly. Hi, everyone, and thank you for the opportunity to be with you. And as you've said, Janet, Uniting is a very large service provider. We support hundreds of thousands of Victorians and Tasmanians every year, and we have about 7,000 staff and volunteers. We see absolutely no need for this bill. In fact, I see it as a very, very destructive initiative by the government. We certainly do not discriminate in terms of the services that we provide, the people that we support. We support people on the basis of need, and we absolutely do not discriminate against people on because of their beliefs or their lifestyle or anything about their humanness. And we also don't discriminate in the employment of staff, and we don't want to. We don't see any necessity for that, and in fact are opposed to anything that grants any exemptions for groups on the basis of religious belief. I think it's important for me, I guess, as probably the person on the panel that does, in a sense, represent a church-based organisation, to be really clear that the Australian Christian lobby and their fellow travellers have felt really hard done by in recent years. With the, of course, overwhelming support for marriage equality in the Australian community, and for what they see is the erosion of some of the family values that their selective theological perspective highlights. They do not represent all people of faith. They represent a very small and narrow group, but they have found fellow travellers in the Liberal and National government, and they have managed to persuade some of those people that there's this kind of silent majority out there that, don't, that feel somehow oppressed because they can't express discriminatory views based on what I consider to be a very narrow and very outmoded theological perspective. What these people do is they grab hold of certain historically embedded parts of the religious texts, range of religious texts. They usually have to do with personal behaviour that's, was kind of culturally contained 2,000 odd years ago, and they somehow make that normative, and then, of course, very conveniently ignore the vast body of theology that's really about human rights and social justice, about inclusion, about respect for the human, and the things that are guiding principles for people like me and organisations like mine. So we have a very clear position. It's a bad idea, it's bad legislation, it's hurtful, it's discriminatory, and it has no place in a modern pluralistic democracy like Australia.
Thank you. Thanks, Bronwyn. Full disclosure, I'm also the CEO of a faith-based organisation, or an organisation with its origins in faith anyway, at Relationship Matters, which was originally Anglican Marriage Guidance Councils. Been around for about 75 years. So I know, Bronwyn, your organisation's also signed up to a statement, which I think is a campaign that Equality, is a small circle, isn't it? Equality Australia have been running around that that does condemn this legislation, and quite a lot of large service organisations, Anglicare, some of the Catholic organisations have also signed up. Ghassan, do you want to tell us a little bit about that statement and that campaign? Because I know that there's quite a number of people in this webinar who are in leadership roles in various human service organisations and may want to participate in that campaign.
Yeah, absolutely. So I think what it shows, first of all, is that this isn't an attack on people of faith, or in fact a campaign against faith. And many faith-based organisations have actually stepped up and said they don't want this piece of legislation. So people can go on our website. There's a statement made from a number of organisations, particularly from Victorian faith-based organisations, Jewish, Catholic, Anglican, Uniting, and others opposed to this bill. If people would like to contact me as well, if they're part of an organisation, I can add you to that, send you that statement and add you to it if your organisation wants to come on board.
I think it's a really great campaign. Certainly when my board had a long discussion about it and were perhaps even more supportive of signing up to the statement than I was as the CEO, I think. And so they were very committed. So it's a really good way to enculturate faith-based organisations at the highest level to consider that statement. So great campaign. Next question's for Heath. What would the bill mean for Australia's well-coordinated public health response to HIV? We're the envy of the world, and obviously this bill could have some impacts on our public health response, but also populations who are most affected by HIV in Australia.
Yeah, thanks for the question, Janet, and also to Thorne Harbour Health for having me on the panel. So AFAO, as a national peak HIV organisation, is deeply concerned with this bill and the implications of the bill for Australia's HIV response. So Australia has a national HIV strategy. We're very lucky that we've had a national strategy since 1989, which guides our response to HIV across the country. The strategy has multi-partisan support and is also supported by all state and territory governments in Australia. This strategy includes ambitious targets to end HIV transmission by 2022, and also to have 95% of people with HIV diagnosed, on treatment and undetectable. Access to screening, HIV screening, so HIV testing, treatment and prevention, so pre-exposure prophylaxis or PrEP, is central to meeting these targets. And for this reason, it is critical that access to healthcare in Australia is safe and inclusive for everyone. Our concern with the bill is that it prioritises the religious beliefs of healthcare workers over the healthcare needs of marginalised individuals and communities. And in the context of HIV in Australia, these communities include gay and bisexual men, trans and gender diverse people, and Aboriginal and Torres Strait Islander people. These populations are priority populations in our national HIV strategy, and at a population-wide level require sensitive and appropriate healthcare to manage the risk of poor sexual health. And we know that gay men are less likely to access medical and clinical care for sexual health purposes out of a fear of being judged. Recent Australian research shows that over 20% of gay men have not told their doctor about their sexuality, and over 22% of these men have never been tested for HIV and are very concerned at the prospects of discussing their sex life with their doctor. In our submission to the Attorney General's inquiry into the draft bill, we highlighted the following specific concerns with the bill. Sections 8.6 and 8.7, the conscientious objection provisions, which Ghassan touched on, we believe will embolden healthcare practitioners to conscientiously object to providing healthcare to individuals on the grounds of religious belief, thus threatening access to PrEP, PEP and testing because a GP's beliefs do not recognise sexual relations between men. Sections 8.3 and 8.4 prevent healthcare practices using pro-diversity policies to stop healthcare professionals in their employ from making discriminatory statements against LGBTIQ plus people that are loosely based on their religious beliefs. And also what we think is an absolute shocker, Section 42, which allows people to express discriminatory comments based on religious beliefs in public without taking responsibility for the implications of these comments on the health and well-being of LGBTIQ plus people. In 2018, a national survey of gay men found that over 80% of participants had experienced stigma and discrimination in the previous 12 months, and 55% reported stigma in the media. AFAO is concerned that Section 42 will enable an individual to defend inaccurate and discriminatory comments about people with or affected by HIV on the grounds the comment is consistent with their religious beliefs. So to conclude, AFAO is deeply concerned with the bill and the implications of the proposed reforms on Australia's considerable ongoing public health investment to end HIV transmission by 2022, and in particular to scale up PrEP to all gay and bisexual men who are at risk of HIV. Thanks.
Thanks, Heath. Just picking up on your comments around practitioners being emboldened to expand on their conscientious objection clauses. We've got a question from Lauren who asks, how are these conscientious objections clauses different to those currently enshrined in legislation, for example, for abortion? I'm not sure whether it's you or Ghassan who might want to have a crack.
I might respectfully defer to Ghassan, who's our technical expert on this panel.
So,
definitely done.
When it comes to existing laws, like in abortion, which regulate when someone can refuse to provide treatment, this bill doesn't override those provisions. So in Victoria, for example, a doctor that refuses to participate in abortion care must refer that patient to another practitioner that will provide that service. The bill doesn't override that requirement. But those laws are very far and few between. Most laws don't say anything about conscientious objection. And in some other states and territories in particular, there's no requirement to refer in any law. And there is nothing, in terms of psychologists or nurses in other areas of healthcare, doctors in other areas of healthcare. And that all relies on codes of conduct and professional standards. And this bill would override all of those areas where there isn't a law. So outside of abortion and assisted dying laws, everything else is up for grabs.
Thanks, Ghassan. And it probably is a good segue into my question for Jamie, which is, obviously a bill such as this that really captures a whole lot of things has some unintended consequences as well, and others might on the panel after Jamie has a go want to pitch in. When we're thinking about the unforeseen impacts on other groups, including religious groups, what can you envisage might be some of the unforeseen impacts of this bill?
Well, Janet, the bill is, of course, so badly drafted and so strange that people have had enormous difficulty working out what it means in the first place. And whether it was unforeseen or unintended are two different questions. But one thing that it will almost certainly do, and it's probably not something that the people who want it to do, is that it will set religious groups against each other, because clearly the religious beliefs, well, there are dozens, indeed hundreds of different sets of religious beliefs according to the Australian Census Bureau, different religious bodies, and many of them, perhaps most of them, think the others are wrong, offensive, heretical, whatever. We're not just talking about the Prime Minister's particular religious beliefs, but we're talking about non-Christian beliefs, Islam, Buddhism, Hinduism, Zoroastrianism. There's a lot. Now, each of them will find that their ability to make statements of belief will easily clash against the others. So one of the things that we used to have was a relatively conflict-free religious climate in this country will become much more a scene of conflict, reminiscent. One hopes not too reminiscent of the 16th and 17th centuries, but those are clearly unforeseen by most people. Many people, in fact, I certainly think that the primary motivation for this is, as was suggested briefly before, some particular extremist religious groups, like, well, it's not actually a religious group, like a certain religious lobby, who feel they've lost a bit of power, and who feel in particular that lesbians and gay men, transgender and gender diverse people threaten their beliefs. So I think most people would expect that they wanted this to target the gays and trans. And what we realise, and what we're now foreseeing, even if they don't, is, and we've talked about it already, this bill, if it were introduced in its current form and passed, would harm women, disabled people, Indigenous people, and of course elderly, children, all sorts of groups who would be the collateral damage. So it's a very large group. Then there's one other unforeseen possibility, which I think one of the interesting academic commentators wrote about, which is to suggest that probably the safest option for any employer would be to avoid, without saying so out loud, employing any religious person who would be likely to, of whom there might be some risk that they would suddenly start invoking the strange, unprecedented powers in this legislation. And the reality is that no one knows how these things would work. And therefore, this bill, if it were to become an act, would cast a cloud of doubt over almost every employment, certainly over hospitals and related things, and make managing them very, very difficult.
I think that's a really interesting point, Jamie, particularly around, I mean, we're a Rainbow Tick accredited organisation. I know Thorne Harbour Health is also a values-driven organisation. Bronwyn, you'd be leading a values-driven organisation. It does beg the question, how do we, and I'll open it to the whole panel, how do we manage progressive values-driven organisations with this sort of legislation, in play? Do you want to have a crack, Bronwyn?
Oh, look, I think it's very, very challenging, because it sort of is a permission-giving thing, and suddenly if you open the floodgates and tacitly give permission, then, people who feel that, even when they lose their temper, that they can get away with saying discriminatory things, are kind of given a voice and given a space within places that, would normally, they would normally feel very uncomfortable being in, because of the values of the organisation.
Ghassan, you're going to perhaps might be able to expand a bit more on some of the examples of the ways that this bill might function. And employment is it's an area that interests me, but might be a good place to start.
So if I could read the government's words back to you, I think this really discloses the real intentions behind these. And let me then give you the translation. So this is from the explanatory notes that are published by the government accompanying the draft legislation, which talks to how different provisions are intended to operate. And one says, in respect of the faith-based organisations exemptions, this recognises that religious hospitals, aged care providers or accommodation providers such as retirement villages may legitimately seek to preserve a religious ethos amongst their staff. What does that mean? That means that anyone who doesn't sign up to the particular institution's religious belief and their view of the proper way of behaving or acting in accordance with that belief can just be terminated without any protection for their own employment. So these provisions that are supposed to protect people's beliefs, religious or lack thereof, are drawn back when it comes to things like religious hospitals, aged care providers. There's no carve out either for the fact that in many of these providers are publicly funded to provide services to people and have the lion's share, in fact, of the service provision. So this is code for we're going to allow faith-based organisations to continue to discriminate, to preserve a religious ethos, which they get to define for themselves, and really cuts across what the whole premise of these laws are supposed to do, which is to preserve the individual's human rights to believe what they wish to believe and to practice that belief in accordance with their own faith.
Which is a great segue into one of our participant questions, which I might direct to the whole panel, but Ghassan, you might be the one who ends up answering. It's a bit technical. So Susan asked, should the bill become law if it were to become law, would it override state laws that deal with a religious person offending or vilifying another religious person? For example, I think the example she's got is Muslims are whatever, or Jews are.
Yes, so this one's a bit tricky. The provision that Heath's referred to, section 42, it does override all state laws that deal with discrimination. So if a Christian boss said to a Muslim employee that some statement based on their belief, which offends, indeed discriminates against that Muslim employee, that could be a protected statement of belief. And so where currently the Muslim employee would have a protection under the Victorian Equal Opportunity Act that protects them from discrimination on the basis of their religion in employment, in goods and services, this bill would remove all those protections in employment, education, provision of goods and services where someone makes one of those protected statements of beliefs. There's some limitations, so you can't seriously intimidate someone, you can't harass them, you can't threaten them, but the words offend are not in this legislation and have been deliberately omitted. So again, you can see what isn't in this legislation is intentional, and intentionally allowing people to, some commentators have said, offend others, even humiliate them because the words don't exist, provided they don't seriously intimidate them. Plain old intimidation's okay though.
Janet, could I make a comment there after Ghassan? One of the issues around a belief and statements of belief and all of these things is that it's not a formal written statement of belief of an organisation. It's basically what one person and one mate think is a religious belief. It is utterly bizarre.
So there's no requirement, Jamie, to find that belief in doctrine or in any sort of official document of any church or organisation? They could just
no, there isn't. There is the requirement that you would expect would be that the statement of belief must have some legitimacy in some written or long cultural tradition. But no, that's not there. One other person thinks it's reasonable for a person of their faith to have that as a belief. So that's one of the problems, one of the many problems with it. And the other thing is that one of the things that this bill would do is it puts the onus of proof in a number of places that it shouldn't be, so that you don't know, and you as an employer won't know, whose job is it to decide? Whose job is it to argue whether or not the statement of belief is legitimate? All the problems go on to the employer, the person who's trying to operate a values-based organisation. So even if these statement of belief makers win each of their arguments, they will have destroyed the organisation they work for in the process. Terrible, terrible stuff.
Or at least the underpinnings of that. I've got a question from Darcy who says, what are the primary, and I think Ghassan, you kind of addressed this in your beginning, but what are the primary motivations and justifications for the bill from the eyes of the beholder, so to speak?
I can have a go. I mean, I'm listening to this conversation. Remember, I'm a former politician. I'm kind of a little bit more simplistic about a lot of this and I really appreciate hearing Ghassan and Heath and Jamie's very learned discourse and thorough examination of the elements of the bill. There's just some politicians just think there's a whole pile of people out there in the community that want to crack blonde jokes, homophobic jokes, want to kind of say nasty things about Islamic people, and that somehow those people feel that in modern Australia they're being crushed by all these do-gooder lefties who, want them to be politically correct. And so that's what's underpinning all of this. And this is just like a sort of cloud of sophisticated legalistic response. But, all it is basically a justification for discrimination because people think there's kind of votes in it. Does that sound too pedestrian?
No, I think it's very welcome. And to cut through, and it probably sounds like something I would say, Bronwyn, when I spend too much time with too many lawyers as well. But in terms of responding, I mean, the question then is, how do we respond to that? Because on the one hand, we've got to tell our community and the broader community to hook into this because it will take away women's rights. It's going to affect disability rights. And, if we think about all of those groups, we need to explain to them how that will happen. But in terms of talking to the pollies, what do you reckon will cut through? Because, my experience of most politicians are that they're not evil. They're generally pretty good people who are dedicating their lives to public life.
Well, I think a lot of it is about storytelling, and I think those kind of scenarios and illustrations, and people are parents, they are brothers and sisters, they have family members, and when you actually really point out the potential unforeseen consequences that Jamie was referring to, what this really could mean, for someone who is desperately ill and then some ideologue is kind of given permission not to treat them, for goodness sake, because they, think that, you imagine someone who's, a single mum who's, dying in childbirth and some ideologue is given permission not to treat her because, she's brought the thing upon herself by her sinful behaviour. I mean, if you start to kind of point that sort of stuff out and tell the stories, and if that's your daughter or your sister, I think that was the power of the marriage equality debate, to be really honest. It was genuinely the personalising of people's life stories. And the thing that you actually were saying, well, you're going to stop people who love each other being together. What kind of country are we? You know, and I think it's the storytelling that is very, very powerful.
And I think that's the storytelling that'll hook other people into, because you're quite right, it's the unintended consequences. And at the moment, I think the media like to portray it that, you know, gays versus God. It's a really reductionist kind of media, I call it the gladiator games. They put the Christians and the Christians and the gays in the arena and let us, you know, kill each other. And it's and watch and enjoy the sport. And I think strategies that change that dynamic by bringing in and making it real for many, many more people, and show that it'll wind back feminism, it'll wind back disability rights and a whole lot of other rafts of human rights is a really good strategy. And that's one that Ghassan, Equality Australia have been embarking on. So with your video, in fact.
Yeah, and you know, I completely agree with Bronwyn, but what's really interesting is that this time the fight's not just ours. This is actually a very basic fight. For the minute that you walk into a doctor's surgery, do you expect to receive judgment and condemnation, or do you expect to receive a professional, non-judgmental service that meets your needs? That is a concern that is not a concern that is just ours. It is a concern for everybody. And I've found, speaking to politicians around this, I don't need to provide them the stories. They provide it themselves. They tell me about growing up in a rural town where there was 2 pharmacies, one of which was known as a Catholic one, and you couldn't get the pill. They tell me about people who've had to travel long distances to be able to access healthcare because they were concerned that they would be met with, value-laden judgment about the properness of their behaviour or not. And this stuff impacts on everyday people's access to healthcare, and we know that they self-select. They don't even go to health. They don't access healthcare because they're worried about being judged.
And not just healthcare, social services, you know, women fleeing domestic violence, partners, you know, in that situation, you know, potentially being turned away because, you know, go and be obedient to your husband.
Yeah.
That sort of stuff.
Unfortunately, as much as I'm enjoying this conversation, we're just starting to hot up. We've run out of time. So one of the questions was from Tanya, which is, if our organisation's already done a submission opposing the bill, should we be looking at another submission when it goes to Parliament? And I think the answer to that is probably. It really depends on the type of inquiry that is created around when the bill actually comes before Parliament and which bit of Parliament does the inquiry. So I think the answer to that really, and for those who want to get involved, is I would suggest you go to Equality Australia's website and sign up to receive information about this bill on a regular basis. And as the campaign hots up, as we know it will eventually, it seems like it's not going to go away as much as we'd love for them to just forget about it. We are going to have a fight, and I think the key message here today is be ready, people, because it's an important fight. So on that basis, I'd like to thank all of the panellists and for coming along. One of the hardest things about doing these Zoom meetings is there's no loud cheers and everybody's cameras off, so you can't even see them. So I'm going to say thank you very much for your preparation and your work and your dedication and your hard work and knowledge around this. And I'm going to call this video to a close. So thank you very much, everybody, for attending. Hopefully you enjoyed it.
Thank you. Bye.
Thanks very much.
Bye-bye.
Thank you.